Chairperson of PRISA Limpopo region, as we have organized this particular session. Our program is going to be very short because we want to afford Dr. Silepe an opportunity to take us through and unpack workplace bullying as the main topic of our webinar today. I would like to welcome everybody, and without a waste of time, I'm gonna request Moses. Moses is our secretary at PRISA Limpopo region to do the welcome of everyone. Moses, over to you.
Sanbonani, hello. Thank you, Chair, for this opportunity. I guess they have seen the invite and know what we are going to discuss, one of the most prevalent topics that so many people are afraid to talk about. So I'd like to welcome everybody. Sit back and relax and enjoy the session. Do not be afraid to engage when that time comes. Chair, without wasting time, I see people are joining in. They will find us along the way. We also have members of the media. They are covering from the University of Limpopo. I see Jackie is there. So you can just take it away and give us the actual purpose of today, what we can expect from this session, and you'll also do the honors of introducing our speaker.
Thank you so much, Secretary, for welcoming us all here. And as you have just said, this session is a topic that it's now on most people's lips. Everyone is talking about it, and I think it's very much important that as PRISA Limpopo, when we met and engaged on some of the topics that we need to cover for our networking sessions, workplace bullying came into the picture. But other people will think, what is workplace bullying doing in a communications profession? But I always say communication cuts across. Everything is about communications. So you can never say we are only specifically associating communication with a specific profession, but it cuts across, it supports every profession that is there. Hence, when there are topics that are very much pressing and interesting for us also to understand, even the psychological part of various topics that we need to cover, we always raise our hand to say, let's see what is it that we'll be able to learn out of this. And hence we said, let's talk to the professionals about this particular topic, which was very much important for us to cover. And I would like to welcome here amongst us is Dr. Silepe. Dr. Silepe is the one that is going to be taking us through the topic of workplace bullying. And she's a clinical psychologist and as a PhD, also a whole brain practitioner when it comes to issues of clinical psychology. She has completed a PhD at University of KZN, and her research interests are in forensic psychology, ethics, and African psychology. She's currently doing a PhD in sexology. And without a waste of much time, I would like to welcome you, Dr. Mantu Silepe, and I would like you to unpack what is it that you have for us, that you prepared, and you are at liberty to take us through in a way that you see fit, wherein we'll be able to understand the topic much better. Over to you, Doctor.
Thank you very much for the warm welcome. And before I proceed, thank you so much for inviting me to this wonderful event where we are going to share knowledge, sometimes experiences, so that we can maintain our mental health. I think you are all aware that this is October, and October is a month where we are actually conscientizing people about mental health. So we would like people to be healthy, because if mentally we are not healthy, we will not be able to be productive. So without wasting time, I would like to share my screen. Oh, it says the host disabled participant sharing screen.
No, well, okay, we've just granted you permission, Doctor.
Okay, let me try again. Oh. All right, there we are. So you can see my screen.
Yes, Doctor.
Okay, thank you so much. That's the emblem of my university where I'm coming from. So I'm proud to be in this institution. Colleagues, thank you so much, because this topic nowadays is a topic that most people, like Mr. Morero has mentioned. I'm trying to move, this thing is not moving. As Mr. Morero has mentioned, it's not, people don't talk about it. The reason being that some of them are afraid to be victimized. And some of them, they feel that, okay, if we can talk about this, it's like we are going to expose ourselves. So hence, people do not want to talk about it. But I'm glad that today we are going to talk about it. I'm going to look at various areas which I think at the end of this session, you will be able to take home. We are going to look at what is workplace bullying. And we are going to look at what is the difference between workplace bullying and the strong management. There's a thin line there. So we are going to look at it. And how does it manifest itself? And what are the implications of this bullying to the organization, to the economy as well of the country? And what are the psychological impact of it, especially to the victim? Although we are aware as well that the perpetrator in most cases also has some challenges, psychological issues, most of them do. And we are going to look at then how do we help individuals who are being bullied, because some of them will have psychological problems, and we need to assist them so that they can be back to normal. So I got this from Facebook. It was quite interesting when I look at it. And I noted that if somebody goes to the public and put something like this, surely as a psychologist, you use your eye as a therapist that something must be happening in the life of this person. And he or she says, when praying for a job, always pray for a working environment that won't lead you to depression. So workplace bullying, it does affect individuals' mental being. And to some extent, it might lead an individual to be depressed. And I think you are all aware that we actually spend most of our time in the workplace. So if you find yourself in a toxic environment or the toxic working environment where you spend much time, surely it's going to drain you emotionally, it's going to affect you emotionally, and eventually it's going to affect your performance and also affect how you relate with members of your family. So hence I said, bravo to you guys for having organized something like this. Now, what is workplace bullying? Workplace bullying, if I were to define it using someone's eye, he says workplace bullying is any type of repetitive abuse. I have underlined repetitive because sometimes certain things you'll see, okay, it once happened in my life, but if it's a repetitive, then it's a concern. The type repetitive abuse, whereby the victim, the receiver of the abuse will suffer. It's either verbal abuse, threats, humiliation, intimidation, and that eventually will affect the performance of this person in that organization. To some extent, it might affect even the health of this person. Now, like I said, I think we need to look at the difference between this workplace bullying and strict management or strong management, so that we shouldn't confuse the two. If you look at the strong management, we know that we do have in psychology or brain profiling, we do have managers, they use their different types of leadership styles, but especially the left brainers, they're quite strict because what they want is performance, you know. And in the process of driving this speedy train or speedy bus, with the aim of achieving the goals, there might be some casualties, which might sometimes be interpreted as a bullying, but you might not find that it actually is not bullying. In that case, you find that the manager is more focused on performance, and he or she wants the work to be done. Okay, so in this case, even though he wants the work to be done, they are kind of reasonable because they know that your failure is their failure. That's the strict management. Okay, but then when you come to a bullying manager has a target. He points a target, or he attacks, or she attacks the target. He abuses his power and position to intimidate a particular person or a particular group of individuals. Because sometimes if you look at the different organizations, in some organizations, I normally say they do have gangsters. Somebody said, man, we're too strong. You rather say groups. There are groups, yes, those small groups in the organization, but I say gangsters because, you know, there are kind of the organization style. This one, if it's a group, he or she attacks a particular group or a particular one. Okay. Failing or not, the person doesn't care, as long as there is an emotional harm to the target. So that's where they differ. Okay. Now, if you look at this cross, this is how it manifests. Bullying can be from bottom to top. You might find that we have an employee who is actually bullying the manager or the director. Okay. Most people do not talk about this because this can easily be dealt with, because the manager can negotiate with this one or take steps because the manager is in power. Bullying can also take this, the peer kind, where you find one employee bullying another employee or another group bullying another group. That also can be dealt with. Procedures can be followed and members can be called to order. If there are disciplinary hearings, they can be done. That's why in most cases, we do not normally talk about these two, bottom, top, sideways. The only concerning form of bullying is when it's coming from the management to the bottom, or sides. It can be like sides, okay? Because these ones, they do not have a strong voice like the manager. So it's quite dangerous, that one. That's what I think we need to concentrate on. And I'm aware that here, as members of PRISA, we have employees, we have managers in the same room. I hope, I do not know you guys. When I present this, it's not like, oh, she knows me or he knows me. That's why she's saying this. We are doing this to help you guys. Okay. Now, let us look at the characteristics of the perpetrator. I'm using perpetrator or the bully for the lack of a better word there. In forensic psychology, what I like is that before we can even attempt to resolve a case, we want to understand who is this person and what is his or her background. Why is he behaving like this? Why is he deriving pleasure in inflicting pain to other people? We have these people in most cases being individuals who are aggressive. And most of them do not have insight to their behavior. They're not even aware that they're inflicting pain to others. But a few do have insight, okay? And some of these people, they are having some traits of dominance and control. That could be either because of their personality. But I have noted something. This one is my opinion from the cases that I have observed. I think that we need to have research in this area. I have noted that most of them, they are from families. I have written background there. When I looked, I have observed several of them, and then I tried to trace their background so that I can see what went wrong. I noticed that most of them, the ones that I have seen, without numbers while I was using a qualitative approach, most of them, they are from well-to-do families. Families that have dominance in the society, or maybe they're from a family that is being well recognized within a particular village or so. Now, they are used to power. That is my opinion. They are used to power. And now, when they find themselves in a high position, yet there is somebody who's smarter than they are, then it becomes a problem for them, because it's like that person wants to take power. They still want to maintain the power and the control. So that's what I have observed. And even if they're not from rich families, but you find that in the past, even though they might not have conduct disorder in psychology, we have those kids, those kids who are very, very causing disruption wherever they are. They're kind of those kids. They do carry those kind of traits, become antisocial and eventually cause pain to other people. Okay. However, we have some of them who might be having this position, a high position, but you find that actually they're not competent, they have low self-esteem, and they have their own unresolved issues. Now, they use the power then to oppress other people. Okay. So that's what we have observed with them. Now, when you look at the victim, on the other hand, honestly, if I had my own bigger institution and they say, what kind of people do you want? I would go for these ones. Because these ones, in most cases, and they are high performers. When they get into the organization, they find that a leader who's having issues, who's having problem with self-confidence, who's having her own problem with power and control. Now, when this one comes and try to make a change, bring up a change, the interpretation from the leader or the director by that time will be, oh, this one is kind of trying to cartoon me that, hey, you're not as good. Look at, we can do this, we can do it. In most cases, whatever they bring on table, which is creativity, because they're very innovative and they're very competent. When they come to the organization, because, well, when we hire people, we want people with fresh ideas. We want people who will bring a change. You know, we want people who are vibrant. But then when they come in, the bully interprets their behavior as if they are targeting him, okay, or as a person now, not leadership style or what, a person. Then what they will do, they will pick the person, the victim, and they'll start hitting very hard. And one other thing that people must know is that when we talk about bullying in the workplace, I normally say it's like mental terrorism, because the person aims at the emotions, the psyche of the person, the victim. And unfortunately, because it's at an emotional level, it's very difficult to pinpoint it. That's why last time when we were talking, I was talking to an attorney about this. She said, you know, it's difficult to have perhaps acts, laws to work on this because we do not have a visible kind of evidence. But we'll talk about it later, what can be done as a way forward. So these people, the victims, in most cases, they have strong morals, integrity there, but because you find that, for instance, in some instance, this one is corrupt, wants the other one to say, man, let's do things this way. Say, no, but ethically, this is not how we should do things. Then you become a target as well, okay? Because you are no longer kind of listening to me, you are threatening, seen or is perceived as threatening my order, okay? Then let's see how it manifests itself when we say, no, I'm being bullied at work. So what is it? What's happening there? You know, you have to tell us. If you say you're being bullied, what's happening? In most cases, people who are being bullied, the bully will be aggressive to them, and the aggression will be displayed either in a verbal or non-verbal manner. Okay? And if somebody is showing an attitude, and you go, let's say you go to court, you want to report this person, what did you do? No, but then she did this, she looked at me this way. They say, but then, do you have evidence? There's no evidence. That's why in most cases, this is not taken very seriously. But the victim can feel that the energy here is not a positive energy. And sometimes the bully will ignore or belittle the colleague's opinion, okay? You go to the meeting, you come with the bright ideas. Remember, we said the victims in most cases, they're very smart, they're very creative. So they will bring on table that, no, we have this program. What if I'm aware that you have been doing things this way? What about we bring this? That kind of idea, no matter how beautiful the idea is going to be ignored. or in some instances is going to be belittled, and immediately it's belittled in public, then the colleague or the victim will withdraw. Because immediately you touch the emotions, you touch the integrity of that person, it's more harmful than, I'm not comparing the emotional and the physical, but it's more harmful. Now, the bully as well will embarrass and kind of publicly degrading and humiliating this fellow. Now, when it comes to the punishment, I have written punishment in red because bullies are quite, they are very strategic in the sense that they will not leave a physical scar. Because when you look at, maybe you look at the X, we'll say, this is a physical thing and there is evidence. And then an action can be taken against that person who inflicted a physical pain. But then they would go to an emotional level instead of physical, because they know that the emotional cannot be traced easily. Okay. And then in some instances, the bully will blame the employee for the things that even the employees actually is not aware of, has not made mistake, but is being blamed. That you did this, whereas it's employee B. And to some extent, the bully, now I would like you to see the psychology behind this kind of behavior. I know for psychologists, they might think that, man, we were not aware. This looks like an antisocial behavior, because we do have a personality there. They also present with this kind of traits, because they like to cause pain. They enjoy causing pain to other people. Now, they would go to an extent of lying to get a colleague in trouble, twisting words, twisting things, because the aim is to do what? Cause mental harm, so that because the aim is to cause mental harm and to let the person go, because the person actually is a threat to him or her. Now, to show that the person now is a bully, remember when we were talking about the strict management or strong management, is you set targets as a manager. Guys, we have to work, we have to do this. There's more of support for your employees. But then when this one sets the targets, he or she sets the targets which are quite impossible for one to achieve. So that there is a record for this victim that this one actually is not competent. And it brings kind of pleasure to him or her when you are unable to achieve the goals, because you are smart. You are smarter. So he's trying to prove that actually you're not smart. This is a person who will pile the work to you and say, Maramemo, there's too much already. No, you're here to work. Now, what will eventually happen, what I have seen with patients, they would take the work home. Now I'm trying to show you the impact of this. They will even take the work home. And immediately you take the work home, you're now intruding into another territory. Because home, the kids want you, your husband wants you, your wife wants you. Now you don't even have time for them. We are going to talk about the impact. And in some instances, they create a competitive environment. The aim being to divide you so that the people, you can fight amongst yourself. And because there will be kind of impossible expectations set for you or goals set, the groups will now attack you. So it's kind of he or he is mobilizing other employees against you. So you can imagine, after I've said this, you can imagine if we have an employee, if on this platform we have such person, or we have people who are victims. You can imagine if we have somebody who is a victim and has been going through emotionally, what is it doing to that person? Because every day you have to go there and you are continuously being criticized. And now the other thing that they display, they micromanage. Remember, with a strict manager, what the strict manager will do will keep on checking, are you winning? I normally use these words, are you winning? Are you coming all right? Where can we help you? But with this one, the managing is such an extent that it's too much for one actually to be productive. So they do it. In some instances, when now, if we have, like I've mentioned, that if we have these workplace gangsters, they isolate you if you are there, because this person would have won the support from the other members of the organization or that unit. Then they're going to isolate you. And immediately when you are isolated, you have nowhere to cry for, you are on your own. There is no support. And immediately you find yourself in an environment where you do not have support. Surely you will not you will not perform well. And now, when they come to you and ask you personal questions about your life or so, or maybe you go on leave, you tell them, I'm going on leave because my husband is sick or my wife is sick, they are going to use the same thing that you have shared with them, which is your weak point, perhaps, to hit you very hard and tease you about it, especially in the public. And what is it doing to you? It's harming your emotions. And to some extent, they will go an extra mile, because I have mentioned that the victims, in most cases, they're hard workers, they're smart, they're innovative. Now, they will take, remember we're talking about the top bottom. They will take your work, and let's say they're going to report this to the senior managers as well. I must say, when the report is given to the manager, the senior manager, your name is not going to be mentioned. They're going to take the credit to themselves, without even mentioning that, Dr. Slepe is the one actually who came with this, and then she went to this extent to do this, to do this, to do this. And then, they take the credit. Okay. And in some instances where the organization, because of performance or whatever, you get, in government, for instance, people used to get those bonuses where if you perform, it's level 3, they rate you by 5 being you are the best. When you go there, instead of rating you 5, and they know that you have been working very hard, they will give you 2, 1, and in that case, you will not even get promotion. And so they block you. So you try by all means to check, what can I do to improve myself? There are so many things, including perhaps if there are conferences you have to attend. They'll say, no, there's a PRISA conference in Botswana, you are not going to be considered. Even the one whom we know in the unit that this one is a lazy one and is not, they will appoint the person, but just because you are there, they're not going to recognize you to go to that kind of conference. So they block every opportunity that might come your way. So you can see when I say it's actually a mental terrorism. Now, people are doing it, but they do not know the implications thereof, especially to the organization and especially to the economy. Because if we are having a company, we want the company to do the best. We want to be, recognized. And if the funds, if it's an organization like a university, we want funds to come our way. But when when the victims find themselves in that toxic environment, always their opinions are disregarded, are ignored, and so on. What's going to happen? They are criticized, then they will start slagging. And immediately when they start slagging, their mentality is, oh, okay, I'm gonna come here, get my check, work for my kids, and go home. And immediately you have that kind of attitude from the employees. You know that the organization is not going anywhere. It will be that like that, you know. So the task performance will go low, will go lower. Creativity, because it's crushed, people will not be creative anymore. And the organization, you know, when I started, I said I'm proud to be the University of Limpopo. And you can see I'm using their logo. You know, you feel there should be, if you have employees, you should be having employees who are proud to be members of that organization, who feels that this is home and whatever I do for the organization, and we want to move on and be competent, you know, as compared to our peers. But if we have that kind of a leader or that kind of a director or a manager in an organization, like I'll always give an example about Limpopo, because I don't know which organizations you are coming from. So I'll just use the one I'm coming from. Not that it is like that, as an example. Now, people would not even want to be identified to the institution, because they don't see themselves as part of this family. And immediately you're not part of the family, you'll not do the best, and you'll not go an extra mile for this family to succeed. Okay, so there isn't going to be any commitment. And you know what's happening, what I've observed. If you have internet, these are people who will spend 90% in their offices searching for work instead of working. They will be, you know, wanting to quit, finding other options. And the problem is, immediately you have a unit or the organization where you are a manager and people quitting. It's a problem, because the resignations of these people cost the organization. First of all, we still have to recruit, we still have to train new employees. You see, so you harm the organization, not knowing that actually attacking this individual, you're actually attacking yourself, you're attacking the institution. I used to say, when you are a manager and you have people resigning in and out like that, during your tenure, let's say, for example, a tenure of 5 years, and then already 2 people have moved out within a short period of space like that, then there's a problem. And unfortunately, if I am to be with you, in most organizations, the HR will give these people a form. What is it actually that has made you to leave? What? They don't tell the truth in most cases. They'll just say, no, it's because of green pastures. There's nothing green pastures. In some instances, yes, in some instances there is. But in some instances, people do not want to identify with the organization anymore. They are done. Okay. And the other thing is, if it continues, you will start seeing, I think the HR people, if they were here, they will start to see a trend of absenteeism. And not because, in some instances, yes, people are sick, but in some instances, because people do not have a motivation to go to the institution or the organization. This is a person, you know, at first, 7 o'clock was at work, was the last one to go home. But nowadays, the person is sick most of the time. The person is late to work. When it's 4 o'clock knock-off time, 3:45 is already at the gate. So there's no commitment, like I was saying earlier on. And to some extent, it might be costly because people might take the organization head on. There might be some litigations. And if there are litigations, remember, we have, as an organization, must have our own lawyers, to represent the organization, so forth. And in some instances, as an organization, we can lose the lawsuits, and it becomes costly, And it also gives a very poor public image of that institution or the organization. That you go there, you'll be stressed, my dear. Don't go there. So because normally, even in people who are in private companies or in private practice, they'll say that the next client that comes to you or the next customer is, in most cases, is brought by somebody who had good recommendations about your organization. So yeah, that's what's happening. Now, as a psychologist, now this is where I'm coming in. After I've outlined the environment, now you can see what other people, you might not be going through that, but this is what people are faced with on a daily basis. And when they come home now, they start presenting with the symptoms of depression. Depression is, because people will say, okay, depression is stress. No, this is a severe stress which affects your occupational functioning, which affects your social functioning. So immediately, if your stress level is affecting your social functioning, how you relate with other people, how you relate with your family, how you even relate to that manager, you start to burst, you don't care, you are irritable. It shows that you are depressed and you become irritable. You don't sleep, you don't eat, some eat more, and to some extent, I think I'm not going to mention names, but in some instances, people do also commit suicide because of the situation they find themselves in their work environment. However, in some instances, you might find that the person will go. I think you might have noted lately or what, though I don't know the reasons, but you find that the people are killing their managers. People are just go there, shoot the manager and go to prison. And you wonder why this person doesn't actually commit suicide himself, So it's because they feel like, I have done my best, I have done this, I've consulted, but there is no change. Remember, with a bully, don't even think that they will change their behavior. So you mustn't have a high expectation that maybe if I become sweet, this person will change. No, they're like that. They have a target and they are having their own aim. Okay. And immediately you have this excessive fear. Some people, to some extent, when I was in the public sector, when they consult, you find that they also have it's depression with psychotic features, where you find that now immediately they become psychotic. It's a serious one. It's a high level of depression. Now you see a person, this one, I will not forget, where she would hear the phone ringing, because I think the manager was in the other side, next door, her office. So every time, even when she's home, she will hear the phone ringing from the manager, and then she starts blocking her ears. She said, you can imagine what that person was going through. So that was a deep level of intrusion into one's personal space. And some can now have, like this one I've mentioned, PTSD, post-traumatic stress disorder. So that's traumatic in itself. You find that the person, I'm just going to give an example. I'm your wife, this is my husband, and my husband is being traumatized or bullied by the manager. Even when we are having sex, the man is no longer having interest. The libido is very low, and at night, some do have nightmares because they'll feel like I didn't finish. I should finish my job. There's something, and then some do become disorientated. You see, so that's the severe impact of bullying. And with others, they take drugs, others, they take substances, so they start abusing them. And because you are always being attacked, your opinions or whatever you bring, their creativity is not taken into consideration. Now, it dampens your spirit, and some do have develop a low self-esteem. And in some instances, these people will begin to be preoccupied with their bullying experiences. Instead of just greeting each other, hello, Maria, hello, Johannes. No. They say, hey, you don't know me. We are suffering. You see, I can't wait to be out of this institution. So it becomes a problem, because all the time they start talking about it. Even at home, the kids will know that there is this Dr. Silepe who's bullying our mom, Yeah. And people will have burnout, always tired, emotionally exhausted. Now, remember we said a bully is deceitful. So then there is people, especially the victim, will start to have a distrust. Every time they're hypervigilant, they hide the information. So there's a lot of distrust between the manager and the employee. So where are we going as an organization? And it also leads to, like I mentioned, unproductive. A person becomes unproductive at work because they also have a low morale. Now, the question is, what then do you do if you find yourself in this situation? When the person comes to me as a patient, normally I say, look, as a psychologist, we follow you, is client-oriented, because you know how much it hurts. So even the young psychologists will say, you do not prescribe to the client, because the client knows where it hurts and how painful it is. You are the one, I'm saying this because you are the one now who should decide where to go. But I normally say, before you can even decide on a way to go, make sure that when you are in that state, you must familiarize yourself with the policies of the organization. Everything. Each and every organization has policies. You must know those policies. What next? If I find myself in this position, what must I do, to attend to this issue? So there are guidelines. Make sure that you follow, you familiarize yourself with those guidelines and start something using the guidelines. And in the process now, because those people, remember, said they're very deceitful, you must document information. Document the date, when did this happen, what time, and what is it that has happened, what did the person say, and how did you feel, which is very important. When your opinion was disregarded, or you were embarrassed in a multidisciplinary team of 30 to 40 people, how did you feel? Write down. This is how I felt emotionally. I felt like a fool. In your own language, you don't have to sound like a psychologist. You just say, I feel bad, I was angry, I feel like killing him, because those feelings do come, right? Okay, so, and because those ones, like I said, they're very deceitful, make sure that whenever you communicate with them, there's a paper trail. Paper trail, use the email. Even if you had a conversation outside verbally, you come back, as we have agreed today, this is, see? Now, an action. You can decide to stay. And when you stay, you report the issue to the authorities using those guidelines of that organization. Okay. Okay, in some instances, some will go to the CCMA route, some will go to the union route, which I'm not really so clear how then what is being done there when they have taken that. Although I have normally, in most cases, I have written reports to such organizations, but I don't know then what decisions do they take and how do they take them. But I have seen most of the patients or clients using those routes. But then I normally say, if you take a route of reporting the issue, perhaps to the seniors or the authorities, you must have a psychologist by your side, because the process is emotionally draining. Okay, so you don't want to start and then give up on the way and then withdraw. If you have started, make sure that you eventually finish. And if you have some EAP programs in your institution, you can use that. The good thing about that, they're also going to document that, okay, we got Dr. Silepe as our client. She reported this case on this day, on this day, on this day. This is what we have done. Remember, that is still internal, right? So it is going to be easy to say, okay, but then even the social workers or the psychologists at the EAP unit, they know about this case. So it's easy for them to take your file and perhaps represent you, or maybe serve as an expert witness in that forum where this case is going to be discussed. But if you are lucky enough, if there are internal arrangements that can be made, the EAP unit can still write a motivation that, okay, Mrs. So-and-so says Dr. Silepe is treating her badly. And we are aware that Mrs. So-and-so has been in our office since 2019 January, and there's no improvement, despite the fact that we had sessions with Dr. Silepe, we have done this, she has not changed. So they can have a recommendation, because those people in the EAP program, in the EAP units, are social workers and some are psychologists. They can make recommendations. They say, then let us move this person from this unit to another unit. It should be, let's say, for instance, you guys, you're in marketing and communications, maybe in another section of the same department, so that the person mustn't directly report to this one who is abusing him. And if now you cannot take it anymore, you can change the jobs and leave the organization rather than committing suicide. And in the process, I normally say it's very important to also consult with the psychologist, because now if you are depressed and you're also having psychotic features, or maybe you are having PTSD, you now need to go to the psychologist to assist you, because in some instances you find that we also need to give you medication. Now the psychiatrist has to be involved. The psychiatrist is the medical doctor who has specialized in mental illness, who's now going to give you medication. And that is important. I normally say to people, once you start therapy, make sure you finish the course. You don't start today and then whilst you are in the process, you leave. No, finish, because the psychologist will also is going to assist in terms of the report, that this is how we started, she was here, there are tests that are going to be administered. And I normally say, when you go to the psychologist, please inform the psychologist that, look, I'm here for counseling or for therapy, but at the end, I might also want a report. So the psychologist is aware now that, okay, this person is going through this. I have now to use tests to back up whatever the case might be. In future, should maybe the person want to lay some litigations, then there are psychometric tests. Because now, if you don't from the beginning, you will then be forced to go to another psychologist who will not be a therapist, but then who will then assess you so that they can eventually give you a report. Okay. So that is the case. And in most cases, the psychologist, when you now decide to stay, because not everybody will leave. I'm not going to leave. Let's say I'm in this wonderful job, and that's the only job that I found after 15 years. You can see now we're having problem of employment. So some people say, I'm not going to leave. Then go to the psychologist who will then assist you with the coping skills that will help you to thrive even in this toxic environment, and also help you to move on emotionally, and also help you then to work in the presence of this person, okay, without being emotionally hurt like you were in the past, okay? And the other thing, attend the stress management training courses with the psychologist. He or she can introduce that during the therapy, and will also help you to buffer the negative effects of aggression from this person. So I normally say when you go to the therapist, because people will want to go to the therapist today and then they want a report tomorrow. No, it's a process. It's a process. We have to give you therapy, and we have to prove that at some point, in as much as we have exhausted all the techniques, this is not working. Then I, Dr. Slepe, a psychologist, I'm recommending that this person be moved, blah, 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 to another section, because if we don't, this person is going to die or might eventually have stroke, you know. So you make sure that you attend those sessions. Now, in my conclusion, I'm saying these words by Zola Mngoma, who was the head of Kwega Development Corporation. She said, people don't leave companies. People leave bad managers. I love this brand. I love University of Limpopo. I love, this logo. I love to be associated with this organization. But then if the organization does not live up to their rallying cry that people are the most precious asset of the organization, then we are going to have a problem. They need to pay closer attention to retaining this resource, because if they don't, people will continually leave. And you will continually train, recruit, train. And you will find that this was a good professor in biochemistry or in mathematics. Now this professor is gone. We are struggling to have a replacement. This professor has gone to maybe UKZN, where I come from. I did my PhD. And once he arrives there, the environment is so cusionic. Then the person does his best. Then when you now compete as universities, then this university is becoming better with the very same resource, human resource you had, but you lost because it was not treated well. So I am saying we are here to do our best. We are here to service our people. But in the process, let's make sure that we do not harm each other. I know we are not here to babysit. If I'm a manager, I'm not here to babysit people. But a good manager is a manager whose EQ is stable and is high. EQ is an emotional intelligence. You must feel your people. You must understand what they are going through. You must support them. Immediately you do that, you will help them to be productive. And your team, I tell you, will win. Thank you very much.
Thank you so much, Dr. Slepe. And I think if we were in a hall or a setup where we see eye to eye, we'll be clapping so many hands right now for you. So I will clap myself.
Yeah, you can
So much more.
you can still clap. You've got a clap sign there. Well done.
Thank you so much. And I think this session has opened my eyes in so many ways. I don't know how I should just thank the whole PRISA team for putting our foot down to say, let's organize it. And thank you also for availing yourself when we request you to come and share with us in terms of things that you do in your profession, and you availed yourself. It's a pleasure, and we thank you so much for availing yourself. I'm looking at the time now, it's already 2 o'clock. I don't know whether you have an opportunity maybe for 2-3 questions before we can close the session. I don't see ourselves having much time for questions and answers, but let's just see how many we can take so far.
Okay.
Can you allow that?
Oh yes, yeah.
Okay. Can I see hands? Who is raising the hands? Mr. Sbego?
Madam, okay, mine is first to thank the professor quickly for this. There are questions that are on the chat, which we would like to go through and facilitate. The Sibongile says visiting a psychologist remains a taboo issue for some Black people. What is your advice to these people? What can one expect when they attend a consultation session? How can one then also use the psychologist report as proof that they have been bullied? How much is disclosed in the report that can be shared with human resources or human capital? Thank you.
Thank you very much. I think there are 3 questions in one. The one of the psychologist being a taboo to visit. What we are doing now, actually, in psychology, we call it a primary intervention, where we psychoeducate people that it is okay to visit a psychologist for maintaining mental health. If you are in an organization, let's say it's a unit like this, marketing and communications, the first step, perhaps if you are a manager, is to invite psychologists to forums like this so that people are aware that, okay, it's not a problem because mental health is as important as physical health, okay? And the other thing is about the report consultation. How can I use the psychologist report as a proof? Okay, there is normally what is happening, the psychologist will give counseling, right? And let's say you go to CCMA, they say, okay, to prove that this thing has been affecting you, all right? We would like to see how did it affect you? To what extent did it affect you? Then that's when now the psychologist will confirm your consultations that Ms. So and so. Now I think I will also respond to the next question. Ms. So and so attended sessions on this date and this and this and this, presenting with depressive symptoms due to work-related stressors. We don't say, no, it's because Dr. Selebe was pinching her, she was looking at, no. We don't go to that extent. Unless now they call you, they say, Dr. Selebe, can you come and be an expert witness in this case and tell us about this? But then normally, before we can do that, we request your permission. As a client, we sit down with you. How much information should we share? You know, and then you give consent, and that's when we come in. But in most cases, the cases that I have written reports for, you just write depression due to work-related stressors. The person, this is what I did, because you have to mention, what did you do as a psychologist? This is what I did, this is what I did, this is what I did. And despite the techniques that I have used, the client still presented with the symptoms of depression. She was also referred to the psychiatrist. The psychiatrist will then confirm that indeed this person came to my office. Now, that is the therapy part of confirming that indeed you came due to work stressors. Now, in terms of wanting a full-fledged report to check the severity of the impact, then another psychologist will be recommended, because that one was for therapy. The other one will be recommended. Now, to do what? To administer tests, the work stressors, what, all this will then confirm, But then it will be what? It will be supported by what the first psychologist confirming that you have been there for therapy. And then this one then will also write the findings from the psychometric tests. Then they will decide out of them. Because if there is a case that goes to court, for instance, because in forensic, I would write a report. You are not saying I'm on the side of the client. This is how it. No, you are providing information that will make the court to make an informed decision. That okay, but we can see that Mrs. Rammuta has been going to the psychologist from this date to this date. So there isn't going to be much disclosure into the content of what we have discussed in the session. So you should not be afraid in terms of the HR knowing more information there about you, because sometimes, remember, the bully is nice to other people, but is a monster to the target. So sometimes to the HR, you find that she or he mobilizes the HR and strategizes a way of conniving and making the HR to look at her with a beautiful eye. So it might be a problem. So we don't disclose much. No. And then the other one, I'm not yet a professor, I'm still a doctor. And the other one says, I'm Jackie from UL Media. I was assigned to cover, kindly request your email. Okay, I think that one, like I was saying, I'm here because of the University of Limpopo. And if the slides are needed or information about me is needed, right protocols will be followed. You will contact the university because still, even if they are my slides, but they are the property of the institution that I'm coming from.
Wow, well captured, Doctor. A special word of thanks all the way from Kenya, Taffy. Taffy says she's very excited and happy that she attended this session. She has learned quite a lot. And another comment is that somebody says it seems as if you're talking to him or her and their organization. Last one from me, Prof. Doctor. So you're going to be Prof soon. You see, we're blessing you already.
Amen.
Is that you are invited by the public relation and communication management practitioners to this session. But what stands out for me is that as practitioners, we deal with communication within our organization. As we deal with communication within our organization, there are a few things that are of importance. One, the image of the organization. Secondly, the brand of the organization. So if you have a staff member that is not well, is not being well treated, the risk is that this staff member can spill the beans and tell media and tell whoever about the organization. And secondly, the staff member may be talking to a very potential or very big client of the organization, which will say, I'm not doing business with you. So in our space, I think we really do need much more in-depth discussion in terms of how do we then look at the image and the brand and the reputation of our organization when it comes to treating of staff and making sure the well-being of the staff is taken care of. Hence, I always say that we must be part of an induction in an organization so that we are able to also advise human capital as to how to go about with critical issues that may lead to disrepute and reputation damage. Thanks, Doctor.
Yeah, that's true, sir. And the other thing I normally say, our managers, in as much as we can label them others as bullies, but they also go through a lot. I think taking them to kind of a session, like this, where you also help them emotionally to deal with those issues. In psychology, even in our training, they encourage us to have our own psychologists because we go through a lot. And when you go through a lot, you also need to have sessions, therapy sessions. So I also have my own psychologist so that when I come back to work, because in our unit, we do train the young counselors. I shouldn't lash at them. I shouldn't abuse them. I should understand that these are kids that are still learning, taking them through the process of learning, but at the same time, taking care of their emotions, because once their emotions are affected, I'm telling you, that's why today, if you look at the statistics, depression is very high. When we look at the statistics of illnesses, it's also rated high, like diabetes and others. So yeah, I think it's something that we need to work on.
Thanks, Doctor. There was a hand raised. Please go ahead. And I'll hand over to Madam Chair to wrap up. There was a hand raised. Please go ahead. Unmute.
Is the hand still up?
Parker. Parker Madimeja.
Okay.
Go ahead.
Thank you very much, Dr. Slepe. I'm highly impressed about the presentation, and I so wish that I could carry you in my pockets so that wherever I go, people can see what I'm having in my pockets. What I want to suggest as well, I should think there are managers there attending these sessions because there are silent bullers, more especially from the management side. Somebody who doesn't give you attention, like you are there, you're just there as a workforce, but seemingly your presence is not felt. Whatever suggestion you may come up with is not there. So what I'm suggesting is that Capricorn District Municipality, I'm seeing Pruti there, she can help me to build up the organization because we are having many silent bullers there, and then of which I always encourage, or induction is a continuous process.
Yes.
And as in when these managers are being taken through inductions, people like you need to be invited so that you help them go through and help them to manage people, because they're just not managing papers. You may find that somebody's managing you as if she or he is managing a paper because not understanding the human being under G, not appreciating what you're doing as well. And then they have got this tendency of the me thing. You giving a report for an organization, you say, I have done. The I and the me in an organization, I don't think they work that much, because if the subordinate is there and he or she has done that, she'll always feel like it's no longer we, it's I. It's I, the manager. Why can't we embrace and say we have done, as the unit, as the organization, as the department, we have done 1, 2, 3, 4. You boost the morale of the employees by so doing. And thank you very much. I think I'll be the second one to invite after PRISA.
Thank you so much. You have said a mouthful, and then this thing of we, I have seen it as a person, when your manager is there, is presenting and say, we have done, you feel so good that, I have contributed, and it boosts the morale, as you are saying. And thank you very much, ma'am. And I hope everything goes well with your managers. And so that the aim, when we have, normally when I'm invited to have this kind of sessions with the managers, is to help them to have insight of their behavior. Once you have insight, then it will kind of help you to change as a being, because it helps you to reflect that, is it me? When you're looking at this, let's say, is it me? Some of them might not realize, but they're juniors in some institution. They'll say, write kind of a comment. How is your manager treating you, without mentioning your name, being anonymous? Then you look at those comments, you say, if my people are responding like this, then it means I must change. They need such sessions as well. And with the permission of my institution, if I'm invited, surely I will come, because my institution has an interest in community development.
Thank you so much, Dr. Silepe. I think we have exhausted all the minutes that we were given extra. We were given until 2:15, and we are already at 2:17. I would like to thank everyone for attending this session. And thank you so much for honoring our request. When we requested you, you honored this particular invitation. It means a lot to us. We have learned a lot to us. And I think the whole aim is to build and to move forward, to take ourselves and the institutions that we work for and our companies to greater heights. And what a better way to do it. Also understanding that the human beings that you have within your institution are not just warm bodies. You don't only have to push them. Like you have problems of your kids, they also have their own problems wherever they come. Let's all understand that together and work towards achieving better goals. Because I believe a better, like you were saying, a person that is mentally stable, that person performs to the best of their ability, and they're always creative, and they always raise their hands when there's something that is needed. They are the first to raise their hands. Let's appreciate that kind of people instead of bullying them. Then we'll progress this particular nation. All of it will grow further. And with those words, I would like to say thank you so much, and also thank all participants for coming through, and also the questions that you have raised. We have learned a lot from them. And I hope this is not the last time that we speak.
No, it's not
the beginning.
Thank you, Doc. Thank you, Puti.
Thank you so much. The session is officially closed.
Thank you.
Thank you, everyone. Bye-bye.
Thank you, leadership.
Bye.
Thank you, Take.
Hi, Gogo. Hello, Gogo.
Hello, everybody. Love you.
Gogo, you're famous.
Bye-bye. Love you, my Puti.
Love you too, Gogo.
Bye-bye.
Bye, Kesia.
Bye-bye. Bye.
Bye, Glory.
Bye, Sbongile. Bye, Saskilwe.
Bye.
Bye, you. Love you.
Love you too.
Love you all. Thank you, leadership.
Allah.
So I left very late, and thank you, Puti.
Thank you very much. Bye-bye.
Okay. Let me do this. I can say, the session that we were having and meeting to, okay. Leaving me. Bernal session psychologist and Dr. Silepe from University of Limpopo. Bernal session Dr. Silepe from University of Limpopo. Yes, I guess he is as well the relevant person to make your organization understand the EAP part in terms of how to manage the psychosocial problems, emotional, spiritual, all good. An employee is a human being in totality. Dr. Selepe from University of Limpopo. Yes. Kita Dinyaka from now.